Welcome to our webinar. We'll get started in another minute or two. It looks like folks are still joining us, so thank you for those that have signed in already, but we'll get started in another minute or two. Well, good afternoon. We're a couple of minutes after the hour, so we will get started with the introductions and then our presentation. I'm very excited today to welcome you to the second of the HHS capacity building trainings for 2023. This training series was developed in response to the capacity assessment that we did as a requirement under the Foundations for Evidence-Based Policymaking Act. And this session in particular is focused on evidence-based grant making. As we know, many of the federal programs and policies are implemented by grantees. That could be at the state level, the local level, the tribal level, or other types of grantees. This gives us as federal grant makers a lot of opportunity to drive effective approaches that use or build better evidence and help us to have a broader evidence base for our programming and policy making down the road. So during this session, we will provide information about how to better integrate the use of and generation of evidence into our grant making by adding incentives to competitive grant programs or by creating tiered evidence programs. Before I introduce our speakers for today, I'd like to cover a couple of housekeeping items. The first is that the webinar is being recorded, and the recording will be posted on the HHS Strategic Planning Resource Center. After we finalize it, we make sure that's 508 compliant. We will post it there so people can look at it. And the other materials from today's session will also be there. And we ask that you please submit your questions for the speakers using the question and answer, the Q&A tool throughout the presentation. We are planning to leave about 10 or 15 minutes at the end of this session for questions. So please put your questions in there. And at the end of the session, we will have a survey to get your feedback about what you thought about the session and this series in general. So I am very, very pleased to introduce our first speaker, Andy Feldman. He is a founder and principal consultant at the Center for Results-Focused Leadership. His work focuses on helping public sector organizations use evidence, data, and innovation to better achieve their missions. He also hosts the Gov Innovator podcast with more than 200 interviews with results-focused leaders. And not to toot my own horn, and if you haven't gotten enough of me over time, episode 192, I highly recommend. That's where I talk about the development of the Administration for Community Living's Office of Performance and Evaluation and how we work to build a culture of learning. But back to Andy. Previously, he was the director of the public sector practice at Grant Thornton, a visiting fellow at Brookings Institution, a special advisor for evidence-based policy with the U.S. Department of Education, a special advisor at the White House Office of Management and Budget, and many other things in this area. So he has a broad history of working in this area. And Andy will be joined later on in a discussion, a nice give and take with Jaclyn Ruiz. Jaclyn is the team lead at the Office of Population Affairs within the Office of the Assistant Secretary for Health and Human Services, so another HHS person. And her role includes overseeing the Teen Pregnancy Prevention Program, a leading example of a federal tiered evidence program, so real life experience with the types of things that Andy will be talking about. And she's held different roles at HHS since 2007, including at SAMHSA and HRSA. So with that, Andy, I will turn it over to you.
Okay, thank you so much, Susan. I'm really glad to be with you all today. I'm going to share my screen here and open up the presentation. And going to make sure that closed captioning is on. Well, this topic that we're going to focus on today, I think has got to be one of the most underrated, under the radar tools of evidence-based decision-making or results-focused government that there is. Because if you ask, the average good government person, name me 10 things to improve government, this may not fall on one of them. And yet it really is so important because so much of government work is done through grant making. And so weaving evidence into that is really important, which I'll talk about more. So in this presentation, we are going to cover two main topics, and that is how to add evidence incentives into competitive grant programs. And those include incentives around building evidence and around using evidence. And then we're going to talk about how to weave in evidence into the DNA of a grant program, especially if it's a new program, using a tiered evidence design. In terms of the big picture here, why this topic is important, because so much of our policy is done through grants, especially at the federal level, grants to the state and local level. If you want to make federal agencies more results focused and more evidence focused, you have to make grant making more results focused and evidence based. And so the goal of this is really to weave in evidence in a way that encourages more return on investment from grant dollars, builds evidence over time about what works, and creates a stronger culture of learning and improvement. So let's move now to the first big topic here. This is going to be a pretty quick presentation, and then we're going to bring in Jaclyn. But please save your questions. If any of these slides strike a question with you, we built in a bunch of time for Q&A, and I would love to hear any of your questions or reflections or additions. In terms of, let me go back one. In terms of adding evidence incentives to competitive grant programs, what that means in a nutshell is if a competitive grant program, for example, has 100 possible points that applicants can be scored on, different eligibility criteria, this would be, for example, carving out 3 of those points or 5 of those points around evidence. So that really is, practically speaking, what we're talking about, designating some selection criteria around evidence. And that could be in 2 forms. That could be designating some points if an applicant shows that they're using evidence. In other words, if they say, for example, or if the grant program says, if you show us a study that backs up what you're going to do as a grantee, a credible study, we will give you 3 points. That's really using evidence at the front end. But you could also do something different. You could say, we will give you an extra 3 points in this competition, or 5 points, etc., if you're willing to help us build evidence. That could be conducting an evaluation if it's feasible in that situation, or it could be being part of a national evaluation. Or you could give points for either, for both. You could say 5 points if you're using evidence and another 5 points if you're helping us build evidence. So that really is the heart of what we're talking about relating to evidence incentives and selection criteria. This next slide just gives an example that we just talked about. 5 points if you show up, for example, a published study based on that, or it could be 5 points if you agree to be part of a national evaluation. Just to be clear about that, the first part there is really about using evidence that already exists to focus money on what works. And the second strategy there is about building evidence. To do this kind of work, to add those kind of incentives, you need a framework that helps determine where grantees are along a continuum of evidence. So, for example, one might specify 4 levels of evidence, starting from the bottom, strong theory, like having a logic model, to evidence of promise, moderate, strong evidence. You can define those levels as you like, but the framework allows you then to say, where is this grantee on these continuum, and to set requirements or incentives. And I'll explain more about that. It should be said before we move on that a program could also simply require an evidence-based approach on any one of these levels. So the decision is whether to create incentives around that. For example, you get 3 extra points in the competition, or if you wanted to, you could just require. Let's say we have enough evidence in this area that we are going to require one of 4 different evidence-based approaches. So incentives versus requirements is something that one would need to decide in taking next steps. So here are some questions to ask about these 2 routes of using evidence and building evidence. Which path might be best for your grant program? Well, if you're thinking about requiring evidence on the front end, the using evidence part, the key question there is really how deep is this evidence base? Are there credible studies for applicants to draw on? Could we as a grant program highlight some studies to make it easy for grantees to know which approaches are evidence-based? So looking at the research evidence base is a key question to deciding whether it's feasible to create incentives around existing evidence. Hopefully that's pretty straightforward. In terms of building evidence, would you want to add incentives to a grant program so that they are doing evaluation work? Well, a question there is, what's the grant size? Is the average grant size large enough to make it reasonable to have part of that money go to an evaluation? So we're dealing with larger grants here, because if you're thinking of carving out $100,000 for an evaluation or some amount, you need a total grant that's big enough to make that useful. I will say as a footnote, you could have grantees be part of a national evaluation where they're not carving out any of their money, but they're just willing to be part of an evaluation. A similar point here is sample size. You need, if you're going to require an evaluation of a grantee's project, you need a project that's big enough to make that evaluation feasible. You need a big enough sample size. So really, for building evidence, we're usually talking about large federal grants, basically, but some of you likely have some of those. So another layer here of how does it work? Once you create that framework with those levels of evidence, an evidence continuum or an evidence framework, you could call it, then you have to decide, well, what are we going to incentivize or require? Which of those levels meet the criteria? They'll get 3 extra points if they show us evidence. Well, what level of evidence? So you have to decide on that, make that part of your RFP, etc. And again, another note, you can simply require that or create incentives. If you have any questions on this stuff, please include them in the Q&A or the chat, because I would love to go deeper on any of this if folks have questions. We are now going to switch topics to a different approach to evidence-based grant making. And this is particularly useful if you're starting a new grant program, because it is different than just adding in some new details to a competitive grant program. This is really building evidence into the DNA of a grant program, and that's called a tiered evidence grant program, also sometimes called an innovation fund. This is what a tiered evidence grant program often looks like. It has 3 different tiers. Applicants can apply to any of those tiers. You don't have to start in one. You could start at scale up or you could start at development. but each of the tiers has different requirements. So scale up would require the most evidence behind that grantee's approach. Maybe in your context, it could be a multi-site randomized trial. And validation could be, for example, one well done, valid study in one place. One study could be enough for a validation. Development might be maybe a strong proof of concept or a strong logic model. And the idea here of a tiered evidence grant program is you're putting the most money on the things that you have the most evidence, but at the same time, you're allowing for innovation. Okay, so let me go to the next slide and you can kind of see how that works. The scale-up grants are the biggest, require the most evidence. Validation grants are smaller, and development grants are the smallest. So you're putting most of your dollars on approaches that have the most evidence. On the other hand, you're allowing for new innovation. And the goal here is for grantees to hopefully move up tiers over time. Let's say they get a development grant. Every one of these tiers, by the way, comes with evaluation dollars and requirements. So you get a development grant, you test out your approach in a proof of concept setting. It seems to be effective. The next round, hopefully you can apply for a validation grant and build your evidence even further. Here are some examples of tiered evidence grant programs, including some at HHS. We have the home visiting grant program. We have teen pregnancy prevention, which we're going to talk with Jaclyn about. There is EIR, Evidence, Innovation, and Research at the Department of Education. That is formerly I3, Investing in Innovation, you may have heard of. And then in a different context, the international space, international development, there's DIV, Development Innovation Ventures at USAID. You can also do a tiered evidence grant program using 2 tiers. And that is what TPP does, that we're going to talk with Jaclyn about. So it's a little bit simpler there. You could, for example, create one tier where it's maybe 75% of your funds to replicate evidence-based programs, but you have another tier that allows you to do more innovation. And we're going to talk with Jaclyn about how that design has actually adapted over time a bit at TPP as their needs have changed. Here's a real-life example that's, I think, quite inspiring. This is in the international development space. There is a nonprofit called Poverty Action, Innovations for Poverty Action, and they had developed an innovative solution to reduce waterborne disease, especially among infants. This is in a developing world context where folks go to a well to draw their water. They bring that bucket back to their village, to their home. And how do you reduce the chances that, a kid puts their hand in there and then gets contaminated and sick? So IPA had this innovative solution of having dispensers at the site of the wells that you twisted the knob, and some water treatment solution was added to the bucket. So they did an RCT, well-designed RCT, showed that it to be effective in getting water treatment solution into the water. How do they scale that up? In a traditional grant program, there may not be that much flexibility to do that, but with DIV there was. DIV is a 3-tiered grant program. The top tier is scale up. Because they had rigorous evidence, they were able to get a scale-up grant. That was a $5.5 million grant. They then implemented this solution to 5 million people in Kenya and Uganda. So it's just a nice example of having the evidence that allowed them through a tiered evidence grant program to go to scale. To wrap up here in terms of big themes, a bunch of agencies, a bunch of departments around government have proof points here that weaving evidence into grant programs can be a really effective way to get more return on investment from dollars, to focus grantees' efforts on things, on approaches backed by evidence, but still importantly, allow for innovation and to keep learning. And I hope these two examples of weaving evidence into existing grant programs through competitive preference points and also tiered evidence grant designs can spark your thinking about which of these might be useful in your own context. So, would love to answer any questions that you all have, or thoughts or comments.
We do have a question actually in the question and answers. Someone asked, can you talk more about suggestions around ensuring continued compliance with evidence-based approaches over the funding period?
It's a great question. Part of this work is ensuring fidelity to the model. And so, you know, I didn't focus on that as much, so I'm really glad someone asked that, because it's one thing to require an evidence-based approach, but ideally, you have the capacity as a grant program to follow up and ensure that they're actually implementing it with fidelity. I would say the same thing, by the way, with evaluation. It's not just about saying we're requiring evaluation and please go do that. These grant programs require following up, TA in many cases, making sure that those evaluations are being done to the standard that the agency wants. So, I mean, big picture, a core part of this whole topic is that this type of work is more resource intensive than the traditional turn the crank grant program that we all know in government exists in many places, where the main goal is getting dollars out the door. This takes more resources. It takes different staff, federal staff to grantee ratio. But the hope is that in return for that, in return for those investments, you're getting a lot more ROI from your grant dollars. It's a great question.
That was the only question we had in the Q&A so far.
Okay. Well, that was a great one. I will, Susan, if this makes sense, I'm going to bring in Jaclyn and encourage folks to keep thinking of questions, and we will take those in the longer Q&A period after this.
Yeah, I think that makes sense. I see some other questions coming in, but let's hold them until after you have a chance to talk with Jaclyn.
Sure. Well, Jaclyn, AKA Lieutenant Colonel Ruiz, we are honored to have you with us. I hope my presentation is useful, but sometimes the most useful thing is really to hear a real life example from the HHS context. So thanks for being with us.
Yeah, absolutely. Thanks for promoting me there too. I think you may have.
Start us off, if you would, with the big picture, which is, tell us about the teen pregnancy prevention program, if you would, from a high level perspective, and how evidence weaves in there.
Sure. And you actually gave a really sort of great simplified version of our program. So as you can tell from the name, the purpose of the Teen Pregnancy Prevention Program is to prevent unintended teen pregnancy across the United States through evidence-based teen pregnancy prevention programs. And our program is set up as a two-tiered program. So tier 1 focuses on implementing those programs that are evidence-based, so have shown some effectiveness at improving an outcome. And then tier 2 is aimed at developing and generating evidence for new programs to prevent unintended teen pregnancy. And so the program really is driven by evidence. It provides this pipeline that allows for us to continuously learn what works, what doesn't, and to share with the communities we're working with, those approaches that are effective at preventing teen pregnancy.
Yeah, that's really, really helpful. When you explain to others about TPP and the unique two-tiered evidence-focused structure that you all have, how do you articulate the value of that versus a more traditional grant program?
Yeah, so the first one is definitely, we believe it reduces controversy. So as I mentioned, the goal of the teen pregnancy prevention program is to prevent unintended teen pregnancy. And as you can imagine, there's a lot of opinions on how you might do that. And so by using an evidence-based approach, we really think it helps quiet that controversy because it separates bias from facts. And so what we're demonstrating is that we are funding what actually works based on data and not just based on someone's personal opinion. The other aspect of this is that we are funding what works and hoping to drive innovation in this space. So we really do believe that we shouldn't just be funding things for the sake of funding it. We feel that the two-tiered model helps us learn what works and to focus our grant funds on implementing those effective programs, but at the same time, learning what doesn't work and what may be missing, and then using that information to intentionally drive innovation in how we approach teen pregnancy prevention.
Mm-hmm. That is really useful. The idea of reducing controversy is not one that's usually cited with tiered evidence, but in your case, because of the topic or politics, to say we're going to focus on evidence is a real value.
Absolutely.
For sure. Plus, independent of that, you've got this structure where you're putting dollars behind evidence-based approaches, but still testing out innovation. So my next question is a little bit related to the question that the audience member asked about, which kind of connects to resources. What does it take to run a grant program like this? If you think of the different resources, staff expertise, staffing levels, other unique factors, what do you highlight that it takes to run this program again versus a more traditional one?
Yeah, so I mean, you're definitely right. It's very resource intensive up front. So it does start with developing your evidence standard. So that criteria that you will use to identify evidence. And so from there, I think you determine how you're going to structure your funding and your overall program, kind of like with the person who asked the question, to make sure you're maintaining that integrity of the evidence-based initiative, making sure you're being within compliance. For us at the TPP program, it's a cooperative agreement. And for folks who may not be familiar, I'm sure many of you are, but a cooperative agreement is a type of grant where the government does have substantial involvement in the grantees project. And so we will review and approve items that the grantee is doing, like along the way, like key milestones of their grant project, to make sure they're maintaining that integrity of an evidence-based program or the evaluation of an evidence-based program, to your point, Andy. And then, of course, a cooperative agreement does require staff that intensely monitors and supports the grantees. However, unlike a typical grant program, we have staff with very specific areas of expertise. And so we have staff with evaluation expertise because these are the folks that clearly understand the evidence standard and how to support the program in making sure that standard is being met. And then we have people with programmatic expertise that can understand how to translate that into practical application within communities. And then we all kind of work together as a team, both evaluation and program, to build this program and build out our funding opportunities and then execute them with grantees. And then in addition to the staff and sort of this funding structure that we have, we do have a key third stakeholder that we rely on, which are those organizations that physically own the program being implemented by our grantees. And so those organizations also have resources that they offer to our grantees that guide them in understanding how exactly to implement an evidence-based program. And they're offering that support with no direct financial resource from us, that we're not giving them any other support other than our negotiated and mutually beneficial goal of meeting the needs of the grantees and ensuring the high quality implementation of those programs.
Mm-hmm. That makes a lot of sense. One quick follow-up question before we move on is, if for the top tier, the ones with strong evidence, is it easy for how do grantees find out what approaches would qualify for that top tier?
That's a really good question. So we actually did work with ASPE. We have, it's a joint effort between ourselves, ASPE and the Administration for Children and Families. And we created that, I talked about the standard, we created this criteria. And we have a contract in place that essentially uses that criteria to scour, does an environmental scan, if you will, to identify programs that meet that criteria. And we have a website. It's called the Teen Pregnancy Prevention Evidence Review website. I could later put it into the chat if people are interested. That identifies these are the programs that have met the standard. So it is kind of an easy one-stop shop for them to identify what programs are eligible. We always give them the flexibility that if they, I mean, we're limited by the resources that we have. So if they do find some other program that meets that same criteria, they can demonstrate that to us and sort of get our approval to be able to implement it. And then all those programs on those lists, for the most part, are owned by like a publishing company or some organization that actually like manages the resource, you know, the curriculum that might be involved, or the user manuals, the fidelity tools. And those are the partnerships that we make. We partner with those folks and we just make sure that they understand what it means for a grantee to be in our program and what expectations a grantee might have of them as a company offering them that program.
Yeah, yeah. You know, just a note that if you look at a bunch of places, and we don't have that big of a set of places that have done tiered evidence grant programs, but whether tiered evidence or weaving in evidence incentives, those grant programs often partner with research experts within the agency. And I guess that's just a tip for everybody, which is, you know, reach out to if there is a research office, you know, or an evidence office. And this is often not done alone as a program. I think of all the programs at the Department of Education that teamed with IES, their research arm, to do this. So that is, I guess, is a tip for everybody. I want to ask you next, Jaclyn, about the challenges of running a evidence-based grant program like this. What comes to mind?
So I've thought about this one. And so it is challenging at times. I would say the biggest challenge that we've experienced in running our program is really finding that balance between evidence and innovation. So you mentioned, Andy, in your presentation that that most tiered evidence grant programs are 3-tiered. So there's a scale-up tier for the approaches with the strongest evidence, a validation tier for approaches with some evidence, and then a development or proof of concept tier for the most innovative or untested approaches. So when we initially designed the TPP program, as I've been saying, right, it's a 2-tiered approach. But the way it was initially designed was really focusing on those top 2 tiers, the scale up and the validation. We wanted to develop new programs and bring innovation into teen pregnancy prevention, but required that those programs funded in that 2nd tier be supported by preliminary evidence, which gave us the assurance that our dollars were going to things that worked or likely worked. But over time, what we found is that the same kinds of programs were getting developed. So we were developing new evidence-based programs, but there really wasn't a lot of diversity or creativity in what was being funded in that 2nd tier. And so, like, for example, certain populations were being left out. Like there were no programs serving LGBTQ youth, or the kinds of programs that the communities were craving really weren't being developed either. So like shorter programs, you can imagine we work with young people. So a 16-week program does have challenges in terms of attrition and retention of youth. So they wanted something like quick, short. And so we would hear these needs from our grantees on the kind of programs they wanted and needed in their community, but our model wasn't being quickly responsive to those needs. And so we needed more of an emphasis on innovation. And so what we did is we split our second tier to add that third tier that you mentioned, where we fund grantees to develop and refine their innovative and at times untested approach. And we started that in 2015, and we continue that same model today. We still call ourselves a two-tiered model. We've just split that second tier into two phases. And so what that means today is that we have options for our grantees to receive funding from us without evidence for their approach. All they have to do is they have to clearly demonstrate that there is a need in their community for the innovation and that their innovation clearly aligns with that need. And now the way we do that at the TPP program in OPA is we actually fund more of a capacity building type grantee. And so the funding goes to an organization that has demonstrated expertise in moving programs from early innovation to rigorous evaluation. And then those organizations fund these innovative projects and provide them with that training and technical support to test their approaches with very early stage evaluation techniques, like the formative evaluation or user feedback, so they can start learning what works and building that preliminary evidence. And so that was a lot.
Well, that's really useful.
But like to take sort of a step back, what we really have now in 2023 is this sort of like three pathways for applicants to come into the program. So there's tier one, they're replicating the evidence-based approaches to scale. There's tier two, a rigorous evaluation track, which is about that rigorous evaluating their approach that has the preliminary evidence. And then there's a tier two innovation track. And that's where we're testing out new and innovative approaches that do not currently have evidence behind them.
Yeah.
And then what we see here is that we are really driving innovation and getting and still maintaining the integrity of evidence that we value so much. Because really our goal is to implement what works, but learn new approaches. And we're just committed to always doing that, sort of continuously learning and adapting as we can.
Yeah, that is so helpful on a bunch of levels, including just the fact that all of these programs that are in this case held up as one of our leading examples of evidence-based grant making also adapts over time. You know, and the structure can change. You all realized you need more early stage innovation. For our audience, essentially, you could think of it as moving back to to a more traditional three-tiered system. It's really two tracks, you know, within one. But I just think that is such a good example of just being aware of the community's needs and adapting. So, Susan, I see you're with us.
I have popped back in. We have a couple of questions in the Q&A. And one of them gets at a topic that you all have just been talking about. What do you think is needed to staff these kinds of programs related to grant officers, given that it's a different type of grant program? For example, do we have to have or require different skills from our grant officers to be able to manage these types of programs?
Jaclyn, can I have you lead on that one?
I will try, and then you let me know if I'm missing anything. But I would say, I mean, I loved what you said, Andy, about the partnership, because there's only so much skill a project officer can have. And I think to expect them to be evaluation experts, plus understand program implementation, plus understand, you know, maybe the individual needs of a community that they're supporting that grantee through, it can be a lot. So we have an evaluation team, and we rely on the evaluation team to give us as project officers support when we're working with those specific grantees that are doing an evaluation, but then to also give us the support for our overall program to help us understand like how we ensure fidelity, what are the kinds of things we should be looking out for, and sort of give us guidance around that. And then on the flip side, with the tiered 1 approach, where they're scaling up these evidence-based approaches, I think honestly, like a project officer that can understand community implementation or whatever your framework is, I don't think it's necessarily a special skill, but it is, they do need to have an understanding of like what it means to be an evidence-based program and what the standard is that you're trying to keep. And so we just do trainings all the time for our staff. I mean, we have like a professional development series for our staff to help them understand like what's the latest with evidence, understand what our criteria means, understand when they're offering support to a grantee, what are the things they look for. And we just constantly meet so that if there are questions coming up, folks can bounce ideas like, hey, a grantee is saying they're going to do this to their program. I think that completely changes the program. Am I right? And like us talk through and bring in our evaluation experts to be like, I think it is. Can you guys give us your thoughts on this? And just sort of manage it that way. I hope that answered the question.
Yeah, I think that was great. We have a couple more questions. Our next question, we have observed a hesitancy about requiring evidence-based approaches if Congress doesn't explicitly require it in our authorizing legislation. What advice do you have to help us encourage programs to use these incentives in the absence of explicit language?
Susan, I almost want to hand that one back to you as a deep evidence expert. That's such a good question. And I don't think I have enough examples to draw on directly. I don't know.
Yeah, I think that really is a tough question. I don't know that we have examples for that, but where we do have competitive grant programs, as we're drafting these statements of work and the grant documents and things like that, if we can maybe carve out a little bit, an aspect of it, part of the money, part of the grant program, part of the focus that focuses on evidence and has a very strong approach to then documenting that evidence and how it improves the outcomes for the people and communities being served, then we are better able to, if you will, sell that approach the next time around, that there's a competitive grant program, that kind of thing.
Right.
But I think by showing how this works, by bringing Jaclyn maybe to come and talk to folks, to say this worked for us, it can work for you as well, then that is one of the things that probably works the best.
Right, right. Yeah, I agree. The one thing I would add is there's an incredible example of what the Department of Education did. They put into their regulations tiers of evidence. Now, in other words, an evidence framework. And it says in their regulations, any grant program can draw on that framework to add incentives. And so that's just really powerful. Every grant program knows if they want to do this direction, go in this direction, they can. And they have a framework that is the same across ed grant programs in terms of the levels of evidence to require choosing one of 4. So anyway, that's something to investigate as well.
Yeah, that's a really good example. Our other question that we have in the Q&A, do you rely on grantees to identify their metrics, or does the grant-making organization outline measurable benchmarks to achieve identified outcomes? Our challenge is that some of the innovations may have different metrics that indicate success.
Do you want me to start, Andy, and you can?
Please. Okay,
so I know for us, we do have specific outcomes, but if you will. So there is, like I said, we created a criteria for what it meant to be an evidence-based program. And so when a program is coming in to be evaluated, we use that same criteria, and that criteria identifies outcomes. And so a grant organization just has to demonstrate to us that they're going to measure one of those outcomes. And like Andy said, we provide them with intensive TA to make sure their evaluation, the design of it, and what the data they're collecting and how they're analyzing it, like is getting them to be able to identify that outcome that they've identified in their application. I say all that though because I hope that one of the lessons learned in our biggest challenges is to remain flexible and adaptable. So we've had the same set of outcomes for quite some time now, and we've learned that through all these innovative ideas and approaches that have been sort of flooding our program, that we might be missing something in what outcomes we want to be measuring. And so we do leave space for grantees to also identify their own outcomes so that we can be learning what else should we be measuring? Like, what are other opportunities to really identify new and different programs?
Great. We got another question. Can you address concerns about equity? For example, that adding evidence requirements or incentives could disadvantage less resourced jurisdictions or organizations. And I'll add to that, maybe there are certain populations that we're serving, certain subpopulations for which there really hasn't been the evidence built. They've been underserved, they've been marginalized. Does it disadvantage organizations that are serving those populations that are not part of the evidence base?
Yeah, I would be glad to start. And I think both Jaclyn and Susan also would love to hear your thoughts. That is such an important concern. And one way to address that is to try and make these requirements as easy to achieve as possible. For example, if you're trying to incentivize a set of grantees to use a set of approaches that you already know have credible evidence, and I just will put this into a very quickly real world situation. When I was at the Department of Education, helping them weave evidence into grants, one of our grant programs was about helping first generation college students to succeed. And we knew there were some really useful, well researched approaches that we thought weren't being used enough. So that grant program made part of their RFP, you get 3 extra points if you use an evidence-based approach. And by the way, look on our website for studies that meet those criteria. And we did webinars with the authors of those studies. And we just put it online. So it's not like trying to find something, make it difficult. Make it easy to say, if you want to get these points, consider these approaches. We did that partly because we just did not want institutions that didn't have a research staff to have to go and hunt for studies, for example. So that's one of many things that I would say. And let me just open it up to Jaclyn or Susan, please.
Jaclyn, do you want to add?
Well, I was going to defer to you. I feel like you might be I would love to hear from you, actually. It's something we are challenged with, which is why we introduced this third tier. But I would love to actually hear other ideas.
Yeah, unfortunately, I don't have the answer, but another sort of answer that fits in with what we've been talking about is possibly, as we have the different tiers of evidence, we could have not exactly a waiver, but if a community, an organization, a population is underserved, under-resourced, and marginalized, and that can be proven, there's evidence to show that these individuals have not necessarily been the folks that have been studied with the evidence. They haven't been in the randomized control trials, that kind of thing. These evidence-based programs haven't been tested in these situations. If there's evidence of that, maybe points could be awarded for that. And then the grantee would also be required to build evidence with that population. And then that would serve everyone in the long run. So there may be some other ways to look at some of those things. And that gets back to the flexibility, Jaclyn, that you've been talking about the whole time. And so we have another question. They are coming in as we're answering. So this is wonderful. Folks, feel free to put in more questions. Any questions we don't get to in this session, we will have a frequently asked questions document that we put together and we post. So even if we don't get to your question in this session, we will answer your question. But the other question in the question and answer is, are there ideas around implementing this approach during a rapid funding cycle where funding suddenly becomes available? We find this situation difficult to build evidence-based funding in, and the funding may not be available year to year in order to improve the RFP year to year based on outcomes.
The situation is that there's not a lot of time for planning. Is that right?
And the money might not be guaranteed. So I don't know if this is what the questioner was asking, but so for example, at the end of a fiscal year, there may be money that wasn't spent, grant awards that came in under, so then there was money left over. And then there's that money that needs to be awarded before the end of the fiscal year. And it's very fast, very fast.
Right. I mean, my first question would be, how robust is the evidence base on whatever topic this is? If this is an area with a bunch of credible evidence, it just makes this whole process easier. And so that would be my first question. If it's robust evidence, then can we quickly create some evidence incentives to the approaches, you know, like I talked about, of preference, competitive preference points, and get that out there, hopefully quickly.
Yeah. And there may be an option perhaps to award those grant funds to existing grantees to then fund additional evidence building. And so that may also be a relatively quick way to spend the money in a really important and informative way.
I was going to add just the note I made about how we fund these capacity building organizations. I mean, that's another really great tool to think about, is maybe you don't have to directly fund folks who are, if you're trying to generate the evidence, because that doesn't exist, that does take a lot of time. But if you invest in sort of like a capacity building grant that can provide TA on a wealth of different items that a grantee might need, and one of them is, how do you generate evidence, and could be supporting organizations. You have so much flexibility when you fund an organization like that, because then they can fund in their time frame, right? They just have this large grant that you've given them, and they can decide how to fund. So we've done that before, where we fund this large organization and they do just like year-long projects, and there's like different cohorts, and those cohorts just get cycled through based on, you know, did it work for them? No, okay, they're out. Now we're going to fund a new, we're going to take that cycle of people who did work and move them into the next cycle. Okay, let's see what worked. No, they didn't work. Okay, we're going to move them on. And it takes a lot of the flexibility out of the funding that we don't have from the government side. I hope that made sense. But that's been like really helpful for us to test out.
Excellent. And so I will take facilitator's preference. I have a question. One of the first things, Andy, that you were talking about was adding points to the grant review. Do you have suggestions or tips, and Jaclyn, certainly feel free to chime in on this, for training the grant reviewers to recognize the evidence so that those points can be allocated properly?
That is a very good question. My two thoughts right away are partner with a research organization in your agency. And also there's good examples of this in other, within HHS, within the Department of Education, how to train reviewers to do this type of work. It could be training your existing staff to do this. It could be forming a partnership where the research office does that work for the program. I've seen both. A bunch of Department of Education programs rely on the research arm, IES, to do the review. On the other hand, you might have a situation where you want to train those staff in-house to do that. And there's good materials available on how to do that. So no need to reinvent anything. Susan, do you agree with that? You're as qualified as, more qualified to answer that.
No, I think that that makes sense. I was also thinking about the case where there may be outside review panels, and then making sure to train those folks, because with those outside review panels, you do want a balance of people that understand the communities that are being served, understand the problem that is being addressed, understand the approaches to the problem. And now we're also asking them to understand evidence and what is credible evidence, what is strong evidence. If someone, a grantee says, this is our evidence, they need to be able to evaluate if it's strong evidence or not. Similarly, if they say we're going to do an evaluation, they need to evaluate, the grant review team needs to evaluate, is this an evaluation? So I was also thinking about those outside folks, but
Yeah.
it sounds like that training or making sure that there maybe are people on the grant review panel that have
Right.
that background.
Right. That's right. I also just wanted to add a footnote before we leave, which is that we talked today only about adding evidence, weaving evidence into competitive grant programs.
Mhm.
We could do another webinar on formula grant programs, which is actually even big, the big dollars.
Mhm.
But just to say one sentence on that, you could, for example, designate some competitive money to go to states or jurisdictions that use their formula money in
Mhm.
evidence-based ways. It could be an
Yeah.
incentive fund to leverage those bigger dollars. So a different topic than today, but I just wanted to highlight that really we were focused today on competitive, which is the easiest way to do this.
Mhm.
But there are important examples for another time on these formula funds.
Absolutely. So we're almost at the top of the hour. I do want to leave a few minutes. Once we close the webinar, for those of you that are here, a pop-up will come up with a survey, a feedback survey. So we would like you to be able to have some time to respond to that feedback survey. So that being said, I want to thank both you, Andrew, and you, Jaclyn, for sharing your insights with us. We really appreciate the information that you've shared with us and the time that we've had with you. And so thank you so much. I don't know if you have any closing words, but otherwise we will close out the webinar. And for those of you that have participated, the feedback form will pop up once the webinar closes.
Well, my thanks to Jaclyn for a terrific example and such useful information. And Susan, thanks for inviting us. It's great to be with all of you today.
Thank you. So with that, we will close out the webinar. Thank you all for attending, and we will have our next session in April talking about different types of evaluation. And we'll send out that material soon so that you'll have that invite and the information about our next session. Thank you, everyone.